Before heading to the surgery, phone the vet first and, outside normal hours, have a pen ready as you may be given another number to ring. Put your pet in a carry basket or box, you may not be the only patient in the waiting room. Illnesses develop quickly with rabbits, and they often do not look ill until they are really unwell to avoid attracting attention from predators. If you think that your pet is unwell, contact the vet immediately, tomorrow might be too late. How do you tell if your rabbit is ill? If your rabbit is quieter than normal, is sitting still and hunched up, does not want to move about, or has not eaten for more than 12 hours, contact your vet as soon as possible. Teeth grinding, severe diarrhea, difficulties in breathing, straining to urinate, or signs of maggot attack, all need urgent veterinary attention. Fly strike in rabbits. Not a tabloid sensation, sadly, this is often all too true. In the warmer months, all rabbits, even indoor rabbits, are at risk of attack by maggots. These eat into the flesh, causing severe damage and releasing toxins, which may produce shock, severe illness, and death. The condition is called fly strike. The risk is increased by conditions causing dirty fur, which attracts flies. Rabbits that cannot clean themselves properly because they are overweight, arthritic, long-haired, have poor balance, are elderly, have a large dewlap, or suffer dental disease are particularly at risk. Open wounds and abscesses also increase the risk, so seek the advice of your vet. You can reduce the likelihood of fly strikes by using fly screens on hutches and runs. The rear guard, a liquid treatment that is applied to the rear half of the rabbit to prevent fly eggs from hatching, is available from vets. It needs reapplication every 10 weeks, and you must still check your pet daily. Avoid diarrhea, make gradual changes to the diet over at least 1 week, especially with spring/early summer grass and leafy greens. Vaccinating your rabbit. All rabbits need vaccinations against myxomatosis and viral hemorrhagic disease. Myxomatosis is a viral disease that is often fatal, although milder forms sometimes occur. It is spread by biting insects such as fleas and mosquitoes, and by contact with an infected rabbit. Vaccination, as with all vaccines, does not guarantee total protection, although vaccinated rabbits are more likely to survive the illness. In the UK, it is currently recommended that the vaccine should be repeated every 6 months in high-risk areas, where there are lots of mosquitoes and/or wild rabbits, and flat marshy areas, and annually elsewhere. Annual vaccinations are best given in spring when biting insects start to become more common. Ask your vet for a suitable product to treat your rabbits, and cats and dogs, for fleas, and protect against mosquitoes. Avoid having stagnant water in your garden and use mosquito-proof screens on hutches. What do rabbits eat? The digestive system of the rabbit has more in common with a horse than with dogs or cats. Rabbits need a high-fiber diet, as without fiber their bowel cannot function properly. Good quality grass or grass hay is the best source, but check that it is free from dust, mold, and grass seeds that might get into their eyes. Feed small quantities of fresh vegetables and remember that cereal-based diets, the muesli type, are high in sugar and low in minerals, and therefore should not be given. Small quantities of high-fiber pellets are a better choice. Introduce new foods gradually to prevent digestive upsets. A peculiarity of rabbits is secotrophy, which means they eat special fecal pellets. These are paste-like, covered in jelly-like mucus, and similar to feces, but softer and bulkier. They are eaten daily when passed, often during grooming at night, and contain essential nutrients. If your rabbit stops eating or passing feces, see a vet as soon as possible. Many problems, as well as digestive upsets, will put your pet off food. Examples include dental disease and stress. Maintaining food intake is vital or further problems may follow. Diarrhea means a visit to the vet, immediately if it is severe and the rabbit is unwell. Mild diarrhea often indicates insufficient fiber in the diet, too many sugary treats, or a change in diet. Look around to see what your pet is eating. Infections do occur in rabbits, especially when young, but they are relatively uncommon. Pale-colored, strong-smelling feces caked at the back end, along with the normal feces in the run, may be uneaten cicatrophs, and often indicate problems such as dental disease or arthritis, reducing mobility. Again, see the vet, and guard against the fly strike. Grooming your rabbit. Wild rabbits groom each other, it is a social activity. Pet bunnies with a short coat need grooming weekly, or more often if they are long-haired. Long hairs can be clipped instead, ask your vet to demonstrate how it is done. Rabbits molt twice a year in the wild, but pet rabbits may molt more frequently. The hair seems to come out in handfuls and bald patches may develop. Molting often starts on the head and spreads down the back to the tummy, but does not always follow a pattern. There is sometimes a distinct line between new and old fur. Groom frequently during molting because swallowing lots of furs can cause a blockage of the bowel. Pluck loose fur with your fingers, or dampen your hands and massage to remove the loose coat. Check the number of feces daily, and if it is reduced or dry, consult the vet. Make sure plenty of hay is available. Does your rabbit have the snuffles? Rabbits are prone to respiratory diseases, so good ventilation is essential. Do not keep your pet in a damp and dusty garden shed. Avoid dusty hay and strong smells. Clean out the hutch regularly. See the vet if your rabbit has a runny nose, eyes, or breathing difficulties. Dental problems can also cause a runny nose or eyes. Exercise your rabbit. Rabbits need daily exercise, preferably outdoors, to keep their bones healthy. But protect them from predators such as cats. Avoid stressing your rabbit. Chronic stress can harm your rabbit's health. Keep threatening predators away and watch for bullying by other pets, including rabbits. Provide hiding places. Rabbit weight. Does your pet have a podgy tummy or a big dewlap? If so, he is probably overweight, and you need to reduce his food, especially treats and pellets. If your pet is losing weight, you may be able to feel an obvious backbone. See the vet. It may indicate a problem such as dental disease. It is a good idea to weigh your bunny monthly. Cutting your rabbit's nails. If the nails are long and curving, you can trim them, but avoid the pink bit, called the quick, in the middle. This hurts and will bleed if it is cut. Ask the vet to show you how to do it. Make sure your rabbit is getting enough exercise. Rabbit coat and ears. Check the coat for scurf, dandruff, or itchy sores, and look in the ears for crusty wax. Fleas are not a big problem, but rabbits can get dog and cat fleas, so get a suitable product from the vet if you have other animals. They can also get ringworm, which is a fungal infection, and infestations of microscopic creatures known as mites. Some types of mites live in the ears, causing severe irritation. In all cases, prompt veterinary treatment is needed. How do I nurse my ill rabbit? Keep your pet in a warm but well-ventilated area. Provide plenty of soft bedding and wipe away discharges from the nose and eyes. Check the rear end for soiling by feces or urine, and offer different types of soft food, including fresh grass if possible, or try bits of apple or pear. You can buy high-fiber liquid foods from the vet and feed them with a syringe, but be careful to do this slowly so you do not choke your pet. Ask the vet to show you how. Alternatively, soften pellets in warm water and then liquidize them. High-sugar baby food should be avoided. However, if your pet will not take anything, inform the vet right away. If you enjoyed this video, kindly press the like button. Also, don't forget to subscribe with notifications on, so that you don't miss out on videos like this. Thank you for watching.